Welcome back to Healthy Living. I'm your host, Melissa Hodgson, and we're talking today about St. Tammany Health System and Ochsner Health and the cancer services available for breast cancer here on the North Shore. We spoke with Cindy Turner, nurse navigator, and Melissa Varnado, nurse practitioner. They talked about early detection, about some of the diagnostic tools available in finding and fighting breast cancer. And next, we're going to talk with Dr. Yasmin Hajja. She's a breast specialist working at St. Tammany Cancer Center, a campus of Ochsner Medical Center. Dr. Hajja, welcome.
Hi.
Thanks for coming into the show.
Thank you. Thank you.
I guess maybe talk first a little bit about yourself. Tell us about your background.
So I'm originally from Middle East, from Jordan. And I've been here almost 10 years. I moved to Louisiana. I did my residency in Baton Rouge and my fellowship in Tulane.
Wonderful. And your area of interest and your area of specialty here is breast cancer.
So, yes.
And so, as I was saying, we kind of talked a little bit about how patients find out that they have breast cancer, how we in our system are able to help them understand what's available to them. But there's something really special going on at the corner of Tyler, Ochsner, and I-12.
Yes, it is.
And that is St. Tammany Cancer Center, a campus of Ochsner Medical Center.
Yes.
Talk a little bit about what's so special there.
So I feel like that when we had this partnership between Ochsner and Tammany with the new cancer center, we were able to increase our ability to provide the best care for our patients in the North Shore. We have this multi-disciplinary breast cancer, or what we call multi-D. We have their exceptional team full of ability to provide to the patient with the best quality of care. We gave them impeccable treatment. Our team has medical breast oncologist, myself, a radiation oncologist, and a dedicated breast surgeon.
Wow. And of course, surgery isn't performed at the cancer center, that's at the hospital.
Yes.
But really, when you think about everything that's available throughout the Covington area, from the Be Well bus in the Women's Pavilion, doing those early detection, and then even at the Women's Pavilion, those highly specialized diagnostics, and then that high-risk clinic helping patients to navigate their way through. And then you have St. Tammany Cancer Center and St. Tammany Health System where surgery is going on, but you're talking about bringing that surgeon down to the cancer center.
Exactly.
That actually, in addition to the work that you do in medical oncology and your colleagues in radiation oncology, that surgeon is present and seeing those patients post-surgery, and you all are doing that multidisciplinary consult to talk about an individual case.
Yes.
And you do that there at the cancer center.
Yes, so the patient comes and sees all of us in one place at the same time.
And to me, that's fascinating. Because if
Exactly.
you think about it, from the time you first find out there's something going on, then if the first available appointment is weeks away, then you talk with that medical oncologist, and then a couple of weeks later you can talk with a radiation oncologist somewhere else, and then a couple of weeks later you can talk with a surgeon somewhere else. And then you've got to go home and sit at your kitchen table and sort that information out alone. That can be really overwhelming.
Exactly.
And so by putting all of these specialists together in this beautiful environment at the cancer center, you're able to have someone come in and work through that progression and think about those different treatment options.
Yep.
With some help from a navigator.
Yes.
And then I think one of the other things that's really fascinating about the Cancer Center is the emotional, social, spiritual component in integrative oncology. Can you talk a little bit from your perspective as a scientist, as a clinician, what that brings to the table?
So, I mean, having a new diagnosis of a cancer, and especially breast cancer, it's not an easy thing to go through. And I feel it's my pleasure sometimes to treat those patients, holding hands and discuss with them and go in every single detail. It's a pleasure, honestly. So when we see the patient together, we discuss the plan, we go over every single detail from imaging, radiation, pathology, and if the patient needs a social support, need any psychology, we do have in our cancer center a psychology, Dr. Tork, and he can help us with everything, and if we need anything from the patient, we can send him up with him and he sees them as an outpatient. Yeah, so I feel emotional support is very important and is one of the best things that proved to help the quality and the mortality and the morbidity of the patients if they're supported emotionally by us. Yeah.
Can you share why you chose to go into your area of specialty? That's fascinating to me.
Well, I've always dreamed to help. I'm always help people. I like to. And it's part of my natural personality. Since I was high school, I always keep telling my parents that I want to find the cure of cancer.
Oh,
yeah,
that's
and I wanna help
wonderful.
them. Yes, I always dream about that.
I think that's fantastic. And then you find yourself specializing more and more. As a child, you say, I want to be a doctor.
Yes.
And then as you get older, you start to realize, I want to be a doctor who's going to make a difference in cancer. I want to cure cancer. And then you begin to realize that cancer is an awfully complicated animal.
Very
So
complicated.
you find your way through that. And you did training in Jordan and in the United States.
Yes. Yeah.
And talk a little bit about your choice to come to South Louisiana.
So I met my husband back in Jordan. He's born and raised in Louisiana, in New Orleans, and we met. We fell in love, and we came all the way from Jordan here. That was pretty much why. But then when I got into the culture of people and the music, the food, the hospitality of the people in the South, it's just amazing. It reminded me of my hometown, to be honest. And I just loved it. Since then, I've been here for almost 10 years, and I feel like I'm home.
That's wonderful.
Yeah.
And it has enabled you to hone your practice entirely into breast cancer with some of the leading specialists in our South Louisiana area. You mentioned Tulane as your training, which is fantastic.
Yes.
And you've now been with Ochsner and St. Tammany and working with all of those specialists in the Cancer Center. And so I think it's interesting to me when we think about the Cancer Center and about how folks are coming into, by the time they're coming to the Cancer Center, they have their diagnosis, they have some semblance of a treatment plan, possibly they've even already done surgery and other things like that, depending on their course of care. And so they're coming into that Cancer Center with a little bit of knowledge and a lot of fear. Yes. And so I think the flow of the place is designed to put people at ease. And so can you talk a little bit about how you work in the Cancer Center with others in that team environment?
So basically the patient comes in the morning or in the afternoon, depends on the appointment. And then he sees me, the surgery, the radiation oncology, and then we come together, we discuss the patient's plan, we go through every little details of their imaging, pathology, radiation, guidelines, everything. And then we come back and do this comprehensive plan and discuss it with the patient. We discuss every little detail with them, and then afterwards, our best goal is to have the patient leave the cancer center with the peace of mind and trust and the confidence that he has a solid plan and that all of his providers are on the same page.
That's fantastic. I love that. You've just kind of walked us through exactly why that Cancer Center is where it is and why we built what we built. And you, I think, are a wonderful representation of the specialized cancer specialists that we have chosen to coalesce together in the Cancer Center with our partner Ochsner. So thank you so much for coming in.
Thank you so much. Pleasure is mine. Thank you for having me.
Indeed. You've been watching Healthy Living, brought to you by St. Tammany Health System. I'm your host, Melissa Hodgson, and we talked today about comprehensive breast cancer care and all of the resources that are available to people who live on the North Shore here in West St. Tammany in the Covington and surrounding areas. Thank you so much for joining us. We'll see you next time on Healthy Living.